Okay, we're looking at blood vessels in the abdominal region, right next to each other here, superior mesenteric artery and vein. The superior mesenteric artery is coming off of the abdominal aorta, and the origin of it is blocked right now by the pancreas. I'll show it to you in just a second. And the superior mesenteric vein also is going up and behind the pancreas, but it's meeting up with the splenic vein, which is right on top of the pancreas here. So the splenic vein and that superior mesenteric vein are going to join together and form the hepatic portal vein. And you'll see this again from a posterior view. Next to the splenic vein, splenic artery, you can trace it back and see that it's a branch off of the celiac trunk. There's two other branches off this celiac trunk. One is not shown, and that's a small vessel that would just come up right here and then loop around the lesser curvature of the stomach, and that would be left gastric. And then the third branch is right here. It's common hepatic. So right about here, we can see that common hepatic is going to branch. The branch that comes down is gastroduodenal, and then it's going to branch, and one branch is going to serve the duodenum, and the other is going to serve the stomach. And so this little piece right here is going to become the right gastroepiploic artery, and it would wrap around the greater curvature of the stomach on the right side. And then coming off of the splenic artery would be a branch that comes around the greater curvature of the stomach on the left side, and that's the left gastroepiploic. And then right about here, it would meet up with the right. And then the right comes around to finish the loop. So gastroduodenal comes off of common hepatic right here. And then what remains of common hepatic is now hepatic artery proper. Hepatic artery proper is running alongside hepatic portal vein. And if we go over to this other model, we can see the hepatic artery proper comes in right here, hepatic portal vein right next to it. So this is just a magnified view of the two vessels we just looked at. So this is the large liver model. Aside from hepatic artery proper and hepatic portal vein, two other vessels you can see on this model, hepatic veins, and there are many of them. So here's a large one. So any vein that we see going from the liver into the inferior vena cava is a hepatic vein. So if I turn this around, you can see more of the inferior vena cava, and you can actually see some additional hepatic veins that empty into it. So coming back to this model, if we turn it around, you can better see the superior mesenteric vein meeting up with the splenic vein to form the hepatic portal vein. And then this vessel here is the inferior mesenteric vein. The inferior mesenteric sometimes joins up with the splenic and superior mesenteric right about here. But in this case, it goes up and empties into splenic, and so it's splenic. And that meets up with superior mesenteric to form hepatic portal. Here you can see the origin of the superior mesenteric artery. It goes right over the left renal vein. And you can see the left renal artery as well, and a few arteries and veins serving the adrenal gland. So you can call them adrenal or suprarenal artery or vein. There's another suprarenal vein on this side, and then the right renal vein and artery, and then a small artery serving the adrenal, so that's another suprarenal artery. And that's it.